Everybody has a story to tell. And sometimes the stories are devastating to hear, and you know they're devastating for the person to actually tell and to have lived and to be living that story. I feel really privileged to be trusted enough that somebody can tell their story and to speak their truth.
At 14 years old, the social worker told me, "Victor, I've got some bad news for you. Your mother died." I had been sheltered at 13 different foster homes. They had taken care of me. I was scared.
I come from a single parent home. My mom raised me.
Before coming here, I never experienced homelessness.
My mom worked her whole life to give me a stable home.
I grew up in a very wealthy family. Yeah, my dad passed away of cancer. And that's what happened.
I had a 401k. We were living off of that. Next thing I knew, we were losing our home. We were living in a car, a little 4-door sedan car.
Gentlemen, good luck.
I had been housed, and then I would lose housing and end up homeless, you know. I was waking up, I'm sleeping outside.
I don't like being homeless, that's for sure. But I had an apartment in Capitol Hill. Rent's kind of high and takes quite a bit of money.
Homelessness is the largest medical crisis that I face on a day-to-day basis.
In this beautiful city of ours, people are dying on our streets. This is devastating.
The number of fears and the amount of fear and the amount of anxiety, it's impossible to even understand.
It's like, you know, we all have things that keep us awake at nighttime.
Mm-hmm.
And it sounds like you're describing what keeps you awake at nighttime.
Yeah, I'm scared. Yeah.
What could happen out there and you're trying to sleep? It's impossible to even understand unless you've been there. I don't think it's understandable unless you've experienced it.
This epidemic is not going away soon, and we're on the front lines dealing with it every day.
Carolyn Downs and the Country Doctor Clinic system is really trying to help patients overcome some of the terrible outcomes that they're at risk of in the face of homelessness.
Poor health is both a cause and a consequence of homelessness.
I'm Jennifer, and I'm a mom. I have 2 little boys.
My name is Nevet. I came from Ethiopia 1 years ago.
I'm from Florida. I like horseback riding, racing.
I have 4 children. I am married.
My name is Victor Lockhart. I was opening chef for Maximilian French restaurant in the public market.
Go first.
My name is Eric. I'm a son and my mother's caregiver.
Home is where I want to be. Pick me up and turn me round.
Home is like, got a key to your own door, you go in, lay on your couch, fix your own food.
My neighbor and then my family. Just comfort. That is my home. Yeah.
To me, home is your home base, you know, it's like where you start everything, you know. Without a home, it's kind of hard.
Home is a place where I feel comfortable, and I hope when people come visit that they also feel comfortable and welcomed.
It's a safe haven. That's what home is.
It's a place of love, actually.
I just want, like, I'm 50 and I want to live that life that I want, you know.
Everybody deserves to live in a safe, secure environment. Everybody deserves to have affordable, accessible, barrier-free health care. In Seattle, we've got horrendous things happening in our city. We've got a public health crisis. We've people, families living on the streets.
It is very emotionally difficult. Oh yeah. It's like there's a wall, talks about the walls, you know, the things that block in.
So the worst outcome that we worry about, death. But even short of death, we see collapse of a person's health and well-being that is intertwined with the whole process of homelessness.
As far as managing a chronic disease, I mean, I was actually scared. I mean, I didn't even know how I became HIV positive, you know.
While my mom was living with me, living in a car,
I just went downhill from that point.
And I was on so much medication. I mean, 3 times a day I was taking medication. That was my option right then, you know, if I want to live.
People enduring homelessness live 30 years less than a housed person.
me questioning myself, how did I fail? What could I have done differently? It is more mental health for me.
I'm glad you're here. Because I can think of all the things that we went through, and I don't think
I
about
don't want to think about all those things.
I know.
Oh man, my dad, he was my best friend. And I'll never forget, he rode a horse named Kosh, and I rode a pony named Marigold. And in my head, I could still remember going through the gate out into the trail on the horses. Like yesterday, that's where I go when things start getting, that's how I keep calm and try to keep my serenity.
When I see patients in our clinics, I think of the word home on a broader sense. I see it as a critical foundation on which everything else is built.
You know what, Jennifer, I hear you, and you're going to be doing it. You're already doing it.
My name is Bernie Craven. I've worked at Carolyn Downs Country Doctor for the last 16 years, and our clinic has supported this work for over 30 years. As an outreach nurse, our goal is to meet our clients where they are. Engaging people in the parking lot, the playground, the bus stop. So it's constantly outreaching and try and build trust with their clients. It's a huge part of the work we do.
All right. I'll see you guys later.
If you have poor health and you are homeless, I'll just put it like this. You have to be channeled. You got to have the resources, you know.
Going to the doctor's office and being able to go to the doctor's office is a big deal there. I'm very grateful for the experience, and I'm grateful for my kids.
There was a park and ride that we felt reasonably safe in. It was over in Bellevue.
By the time November rolled around, the heavy cold rains and the snow came. You can't run the car all the time for heat because you can't afford the extra gas.
Okay? Yeah. Eric, take care of Mom. All right.
When I hear the stories from my patients who are homeless about the really difficult decisions they have to make, that oftentimes the things that I think are important as a doctor, such as taking your medicine and eating a healthy diet, just fall by the wayside when a person's struggling to survive.
For me, it was a matter of mobility. I mean, we were stuck in the car a lot. No room to put my feet up, and they started swelling. There was a point when I couldn't even get my shoes on because they were so swollen.
You want to make sure nobody bothers you while you're sleeping. You know, takes your backpack because they want what you got. And then your medications in there is keeping you alive, you know.
No showers, my kids not being able to get to school.
For a family experiencing homelessness, the issues get really compounded because the primary parent or caretaker making great sacrifices themselves to try and care for their more vulnerable family members.
I contracted prostate cancer. I did radiation for 9 weeks, 5 days a week. And the machine, and it drained me. country doctor, actually, they took me through the whole excursion. My doctor, Dr. Johnson, wow. She's very compassionate. I tell people, my doctor is my friend. You know, we have that relationship. That's what I love about her. It makes you feel in charge of your life.
I'm proud that Country Doctor and Carolyn Downs clinics make an effort to reach out to patients no matter their ability to pay, and I think everyone at this organization really stands by that.
I'm not in poor health. I'm in better hands. I'll just put it like this.
The picture that I imagine, the real one, every morning, like I tell my son, every morning we wake up and the sun's there and we have a chance for another day.
I have to be optimistic, otherwise, I have to be.
My wishes and my hopes for my son is that he'll be able to stop feeling so responsible and guilty about things that weren't in our power to control.
So in the future, I don't explain. Sorry. My child, in the future, everything better, I think. You understand?
Yeah, I know. It's hard. And I know you love your kids so much. Let's just recognize that we have a problem, and that's called homelessness.